Australia and New Zealand are two of the safest countries in the world to have an operation under anaesthesia. But some patients, particularly the very old and the very sick, require extra care before and after their operation to ensure they're ready for surgery in the first place and have the best chance of an optimal recovery once the operation is over. Extending the coordinated care you get in the operating theatre either side of your surgery is called perioperative medicine, and it can make a massive difference. Take Barry, for example. He's having knee replacement surgery. His surgical and anaesthetic teams are working closely together to make sure his operation goes smoothly. But Barry's surgical journey started long before he got to hospital. On his 80th birthday, Barry had a fall and injured his knee. Over the next few weeks, the pain got worse and started affecting his ability to get around. His daughter takes him to see the family GP, who refers Barry to an orthopaedic surgeon. The GP explains that because Barry has some underlying health problems, the surgical team will need to assess his suitability for surgery. Every year, many operations have to be deferred because the patient's condition could put them at increased risk of complications during or after surgery. The surgeon reviews Barry's medical records and confirms that due to Barry's age and the fact that he has an existing heart condition, high blood pressure, diabetes and asthma, he's at an increased risk of post-surgical complications. She explains that the hospital provides a perioperative care service to help complex patients like Barry prepare for and recover from surgery. She makes an appointment for him to see the anaesthetist, who will be in charge of coordinating Barry's perioperative care. Anaesthetists have a specialist understanding of what it takes to prepare a patient for anaesthesia and avoid post-operative complications. After discussing the options with Barry and his daughter, and understanding Barry's wishes to continue living independently, the anaesthetist suggests they delay surgery for a few months to give Barry time to get his general health back on track. He tells Barry that he'll put together a team of healthcare professionals who will help him manage his underlying health conditions and get him ready for surgery. Over the next few months, Barry will be under the care of a diabetes nurse specialist, a physiotherapist, a dietitian, a respiratory physician, and a geriatrician. They will all work together with Barry to monitor and improve his health and well-being, making sure to keep his surgeon, anaesthetist, and GP in the loop. The specialist coordinating the perioperative care team plays a similar role to the conductor of an orchestra or the coach of a footy team. Thanks to the extra care he received before his operation, Barry's recovery is going well, and he's looking forward to going home soon. Before Barry is discharged from hospital, his anaesthetist prescribes him medication to manage his pain and provides an update to his GP. Barry's perioperative care will continue for the next few months, making it less likely that he'll need to be readmitted to hospital and allowing him to continue living independently. For frail, elderly, and complex patients like Barry, access to an integrated, personalised, and planned perioperative approach to surgery can significantly reduce the risk of post-operative complications, such as pneumonia, delirium, heart attack, or sepsis. Complications arising after surgery are one of the leading causes of death in the developed world. Perioperative care can also significantly reduce the number of people requiring intensive care or readmission to hospital, freeing up precious resources for other patients. ANZCA is taking the lead in establishing the perioperative care approach in hospitals around Australia and New Zealand. We provide formal training to specialist doctors such as anaesthetists, geriatricians, and surgeons.